Okay, so thank you everybody for joining us today in our Global Neurosurgery Roundtable webinar. My name is Dr. Roman Sabas. I'm currently working as a research fellow under Weill Cornell Tanzania Neurosurgical Initiative, a collaboration between the two universities, one from America, which is Weill Cornell, and the other one is here at Tanzania. So we are pleased to have Karen March, a global education consultant. But before we start with anything, I would like to take you through the housekeeping rules and the regulations that I would like to be followed. Sorry. So please keep your microphone muted during presentation to minimize distraction. The host may mute you if needed. Please raise your hand during the Q&A session if you have any question. Once you are called on, please unmute your mic and remember to mute yourself again after your question has been answered. We are live streaming this webinar on YouTube, and it will be available on YouTube after the event. If you do not wish to be seen, please be sure your camera is turned off. Leaving your camera on indicates your agreement to be streamed in public. Webinar are usually offered on Thursday of each month around 10 a.m. New York time, and of course may change according to your local time. So I'm privileged to introduce to you Karen March, currently a global education consultant. Karen March has been a neuroscience and a critical care nurse for over 5 years as a neuroscience clinical nurse specialist after graduating from the Masters in Nursing program at the University of Washington. For 14 years, Karen worked for Integral Neurosurgery as a director of clinical development. Karen has lectured nationally and internationally on a variety of neuroscience and critical care topics for more than 35 years, and has also published on various neuroscience topics, including 4 chapters for core curriculum of neuroscience nurses. Karen has been on board of directors and the president of the Neuroscience Nursing Certification Board, and on the board of director of the American Association of Neuroscience Nurses, and currently the secretary or treasurer of the World Federation of Neuroscience Nurses. Since 2007, Karen has been working in global health, focusing on developing neuroscience, nursing, and critical care primarily in Tanzania and Uganda, but has also worked in Ethiopia and taught a neurotrauma curriculum online for Sierra Leone. In recent years, she has been a member of WFNS Global Neurosurgery Nursing Committee and is currently the co-chair. In 2024, she launched an online neurotrauma curriculum for nurses through the Global Neuro Foundation. We are so happy to welcome you, Karen March, in our webinar series today. Please, the floor is yours.
Well, so nice to be here with everyone. I look forward to hearing from folks if anyone has any questions after we get started. So what I wanted to talk about is really what are some of the obstacles and challenges that we have when we are providing global capacity building neuroscience education, and also highlight some of the successes in providing capacity building neuroscience education and outline what is needed to strengthen neuroscience nursing. So I thought I'd start out, as Ramani had said, I started in 2007 working in East Africa. So I initially went in August of 2007 with a group from Duke University to Uganda. And then following that, in January of 2008, was when I first came to Tanzania. But as you can sort of see with all these little dots, I've been teaching around the world. And I first started in around 1991 when I went to China for the first time. And so through the years, I've learned a lot about teaching in other countries, but I think it's always an evolution. We need to learn from one another how to make it effective. So we have to understand certain things to be effective and have sustainable neuroscience nursing education. First off, we have to understand, what is the local education? What does it look like? Are the nurses mostly sort of practical nurses? Do they have diplomas? Are they aides? Or do they have what in many of the countries we say are more advanced education, which is a bachelor's degree, master's degree, or a doctorate in nursing? We also have to understand what the philosophy of nursing is. What are the nurses being taught? Are they being taught task-oriented nursing, which is really how just to do specific tasks, or are they embracing nursing process, which was a style of nursing that began in the 1950s and I think is now taught in most of the world. But I can say when I first came to Tanzania and I was in the remote hospital at Haydom, they were still teaching task-oriented nursing to the nursing students. While I was there, they started teaching the nursing process. One of the challenges when it's just starting to implement this nursing process or critical thinking is that there aren't a lot of mentors. So when I was at the hospitals, they were always very happy because I could help to teach and mentor the students and the nurses. We have to understand the practice of nursing. And as I've traveled around the world, I've found out that even in high-income countries, what I know from the United States is not necessarily what practice is in other parts of the world. So it's helpful to understand. In fact, I can tell you in the early 2000s, in one of my first trips, I was in the UK, I was teaching about neuroassessment, and one of the nurses raised her hand and said, well, when would I do that? We don't do this. So things change over time. Now I think it's much more common that nurses are doing assessments, but it's still not the case in every place of the world. So you need to understand, what is the culture of what nurses do? Are they providing the medications? Does everyone provide the medications, or only certain nurses? Who manages the ventilators? In the high-income countries like the United States, we have respiratory therapists who set up the ventilators. They help with the care. They're specially trained individuals who focus on respiratory care. Nurses then supplement that. Or is the nurse, as I found in much of Africa, the person who sets up the ventilators? And that their physical therapists also operate to manage patients' pulmonary care. Who manages the extraventricular drains or our CSF drains? Maybe is it a shared procedure? Who does the feeding? How do they do the feeding? And other tasks. So it's important to understand what nurses are currently doing when you're teaching them. You have to understand their environment, what it looks like that they're teaching. Is it new equipment, old equipment? Is it equipment that's been donated? Are there beds enough beds for the patients? And those of you from Tanzania, I'm sure remember this in the wards where you go and there's not only not enough beds, and there are not enough nurses for the beds that they do have, let alone the fact that there are patients that you're nursing on the floor. What equipment do they have? You know, and things change over time. We also have to understand then what is all the, what's available when we're teaching. When I was just teaching the class in Sierra Leone, they are brand new to starting neurosurgery. And they had a physician who was being cross-trained to do life-saving neurosurgery. And we talked about CT and MRI. Well, they don't have that at the moment. They were getting their first CT scan. So we have to understand what they have, and then is it available to everyone? Who pays? Do they have a universal health system where everything is paid for? Or do they have to have supplemental insurance? Or is it the family who pays? Because that also influences what, when you're teaching, what they can actually do. If a family has to pay, some of the what we do for our patients is delayed. And so that influences how timely the care can be. And you have to understand what is available and not teach to what you are used to doing, especially those of us who are coming in from outside. One of the challenges is the lack of supplies, you know, and the consistency of supplies. So if I am teaching about how to manage an extraventricular drain, and one thing I have seen frequently is that I will teach them about this, how to manage a drain, but the system changes frequently. You know, so I might have a different system every time I go to the Tanzania or Uganda. And so that makes it difficult, especially for novices who are new to managing the neuroscience patient. And if they don't have consistent supplies, they have to, it's harder for them to translate how to care for the patient. Another challenge is when you're providing education is the educational level of the nurses. And you may have many different levels within a group that you're teaching, and some may have very basic knowledge. And I'll say an example is just teaching the anatomy for the neurotrauma course that we just did for Sierra Leone. They didn't understand some of the anatomy that we were talking about. This was new to them. So sometimes you have to go really basic in order for them to understand what you want them to be able to do so they can provide the care for these patients. And it may be that there are some people in the group that have higher levels of education, and you might target them with some very specific education because they can become the teachers. And they may be the teachers in the unit or in the area. And then what is the workforce culture? And that includes both within the nursing care at the bedside, but also when we're talking about the management and the ministries of health. What is the culture? Because that also helps to tailor your education appropriate to your environment. So providing effective and sustainable education it's important to involve those who you are teaching. And, you know, we adapt to where we're going to teach. You know, this picture here is one from Uganda in their, in Mulago, in their ICU, and this was an unused part of the ICU, and nurses would come, and student nurses would be there, and we would be teaching the topics. Early on in my time in Uganda, they asked, because when I first went there, they had no critical care training and no neuro training. So I sat down with the nurse manager and several of the unofficial leaders, as well as the physicians, their neurointensivists and neurosurgeons, say, what do they need? What do they have? What do we want to focus on? And we developed a curriculum that I provided over the years. And as we move forward, some topics we would repeat, and I would have students that became teachers, and I mentored them into teaching some of the topics, so that when I left, they were filling in and becoming the future teachers for that area. Sometimes you don't know. And one of the challenges through the years that I've had is that when I have gone to teach, I don't know enough about the environment, but I learned over the time that I would ask questions before I got there to help me tailor my lectures a little bit for their environment. But it's always helpful to spend time in the environment as you're going to teach. Another lesson I learned is sometimes I had ideas of what I wanted to teach, and I would, come prepared to teach certain things, but I also really spent a lot of time asking them and identifying where there may be patient situations that we can develop a teaching plan over the time and focus on. An example would be a spinal cord patient, because they may not always have those patients, but if they start to see them and they have a patient, it makes more effective teaching. Some other things that I learned when I am teaching is to try to speak slowly and clearly, not use abbreviations, or when I do, spell them out so that everyone, especially on slides, knows what you are talking about. And I found even as I traveled in the United States, sometimes I would go to another part of the US, and they would use an abbreviation that meant one thing to me, but it meant something else to them. So it's really important so that we are clear of what we are talking about. We have to be careful about humor because humor is something that is very local and sometimes does not translate to a local community. We want to use simple and clear terminology. Sometimes we become too almost in trying to use higher levels of technology. It may be the specific term for a disease or a problem, but if they are not clear, if you want to use it, you also need to explain it so that it's easier to translate. We want to be careful about the names of drugs that we use and to use brand names, not generic names, or not to use brand names. We want to use, so I want to say mannitol, or if I use it, I might use two names so that someone may understand better. You also want to understand the metrics that they use or provide options. So do they use micrograms or milligrams? Do they use kilopascals or do they use millimeters of mercury? So there are certain things, and I've taken to some lectures, like when I do something that's going to be used globally, to use both terms that I know are typically used. Use examples or case examples, and then to teach with evidence-based and best practices. One of the biggest challenges, I think, is that often in developing low middle income countries, that they are not aware of what all the best practices or evidence-based practice is. So it's helpful to provide that for them. There are a lot of approaches to capacity building education. And I always like this proverb where it says, you can give a man a fish and he will eat for a day, or you can teach a man to fish and he will eat for a lifetime. I think we always have to keep that in mind. Sometimes medical missions, people come in, they come once or twice, they do surgeries and they go away, or they teach and they go away and they never go back. And so we really need to have repetition and to find those people who within the community who you want to mentor to become the teachers, because it's not about us being there teaching, it's about empowering others. And there are many philosophies of extended stays, people living in the community for a year or two, 6 months, or short repetitions. I have done the short repetitions, but I spent the initial probably 10 years or so coming at least twice a year for a week in multiple areas. I've done a little bit less in the more recent years, but I've been teaching through different methods, like on Zoom, as we've gotten more capacity to do that remote teaching, and to train the trainers. The future is for those in Africa to be able to work with their peers long distance, but to teach their peers in the community. So some of the successes is, one of my dreams was to put together a neurotrauma course for nurses. And I got involved with a group called Global Neuro Foundation, which had been providing education for physicians. And I started doing some webinars and some with them, and took almost 2 years to develop the curriculum for the nursing course. And I'm happy to say last year we finally launched it, and we had 151 people register for the course. 112 of those were from low middle income countries. 84% of those who registered actually completed the course. And of that, 82% actually were successful. And in low middle income countries, there was a 71% success rate, which I think was great. I think it probably would have been even better, but the group of nurses from Sierra Leone took this course, and there was a wide variety of knowledge. And I think for some of them, it was, even though it was a basic course, it was too advanced for them. So it sort of took me back to say, we need something even more basic and fundamental. I proud to say that a number of the nurses that I worked with through the almost 2 decades of coming to Africa are now taking leadership roles. There's a group of nurses in Tanzania who've started a teaching group called Pioneers in Neuroscience Nursing in Tanzania, which I'm very proud of what they're doing. And it's evolving, but that's how change and education within a country can take place. I have a number of the nurses that I've worked with that have gone on for advanced degrees, who are participating in professional groups and also participating in research. So, and one of the challenges is research is not something that is widely taught in undergraduate or even some of the graduate programs. So this is great to see them participate in programs. You know, as Romani said, I got involved with a group from that's doing global neurosurgery, neuroscience committee that's part of the World Federation of Neurosurgeons, who have a global neurosurgery group. And they realized that they really needed nurses involved in this. And so I have a number of nurses from Tanzania and Uganda who have joined in with that group. Because to make change globally, we need to have the perspective of many countries. So what do we need for the future? We need some consistent standardized fundamentals in neuroscience nursing courses, so they can be online or in person. And actually, it's helpful to do a combination of those things. And it needs to either be free or affordable to all nurses. We need in-person skills development, because you cannot just do curriculum teaching without actually being at the bedside, helping them learn to actually care for the patients and to mentor and role model the skills. We really need to focus on teaching and developing evidence-based protocols and guidelines. And there are quite a number of them that are out there from high-income countries, but we need to figure out how to adapt them for the environment and the resources that are available in an individual country. And I also think it'd be helpful to develop some maybe some apps, some real-time pocket tools that nurses can carry around with them, to sort of ask a question if they're not sure, maybe small videos on an app of how to provide the care. We need to develop better partnerships between academic centers, NGOs, and private foundations and professional groups. One of the things that we're trying to do with this Global Nursing Committee right now is to do that, is saying there are many people who are trying to provide education in different countries, but we're not very good at talking to each other. And that we try to reinvent the education when we should actually just be trying to work together to provide better education. We need mentorship programs. We need to provide, and we don't actually have to always be on site to provide mentorship. We need certification and recognition. So here you can see, this is a group of the nurses in Sierra Leone who were successful in taking the course, and they're very proudly, they had a ceremony at the hospital for them. So the certificates that they received, and these were done with accreditation in the Western accreditation system, but they got a certificate that showed that they completed a course successfully. And those are important. You know, what do they need? And then to develop scholarships and fellowships for nurses to sometimes spend some time in a different environment where they can learn from their peers on how to provide the best care for their patients. You know, teaching and seeing are two different things. So in conclusion, we really need to understand our students when we're developing education. We need to understand the environment, identify the challenges, establish partnerships, and provide professional support ongoing for all the students. I want to thank you for your time. And this was a wall in Bagamoyo when I visited there, and I love these sayings. I thought they were good ways to finish up the thing. You know, I like teamwork means more of we and less of me. You know, these are all sort of good sayings for us all to remember. Thank you for your time.
Wow.
Happy to, any questions?
Thank you so much, Karen, for the nice presentation. I would like to welcome for more questions, contributions. One from the chat, she's called Masa Arupo. Thanks, Karen. You did an excellent work for us here in Uganda, and we are proud of you. I'm one of those you brought up in critical care in Uganda. That is Mata from Uganda. So, anyone, please, you can raise your hand or you can unmute yourself and ask your question. Welcome, Sylvia. Sylvia, you can unmute yourself.
Thank you so much, Karim, for such a wonderful and informative presentation. My question goes to how can you make those short courses in neuroscience to be accredited and approved by respective nursing authority in low and middle income countries? Thank you.
I think that is a challenge, and you know, I think one of the biggest challenges I know is that you have to understand, how do those accreditations, what is important, and are there organizations? So things like, I know in Uganda, what we did do was I was able to get a certificate from the World Federation of Neuroscience Nurses for the curriculum we did for them. But I think that's something that there is no universal accreditation. So in the United States, we have several accreditation boards that we can use. But globally, I think it is something that is different. And maybe we need to find out in Tanzania from the ministry, you know, is there a certification body or someone, you know, through a university that could provide those kinds of certificates?
Thank you, Karim, for such a response.
Yeah, so Dr. Shabani, you are allowed to unmute and if possible to say something. I see your comment. Thanks so much, Dr. Karen. We need to convince COSEXA to establish neuroscience nurse courses. Can you elaborate more, Dr. Shabani, on this?
Yeah, thank you very much. I wanted Dr. Karen's team to see how they can come together, meet the COSEXA Council, and work together to establish the neuroscience curriculum, neuroscience nursing curriculum. That's the only way I can see that we can develop in this part of this region. If we get courses which are locally available and run locally, it becomes more sustainable and more effective. Yeah.
I agree, Dr. Shivani. I think that would be a great way to move forward, is with the local organization. I know in Ethiopia, they have been working at the university level to create a neuroscience course. And that's what you need. And it shouldn't be each country. It would be, I think, advantageous to have it available to the region rather than just individual countries or regions.
Yeah. All right. Anyone with any comment or question? So we have left with only 2 minutes to complete our webinar. Okay, so coming next, we'll be having Dr. Beverly Cheserem, a neurosurgeon from Aga Khan University Hospital in Nairobi, and she's going to take us through a neurosurgery mentorship in East Africa, opportunities in global neurosurgery for young trainees and faculty. Again, it will be the third Thursday of March 2025, similar time as today. So overall, thank you so much, everybody. I wish to see you again in the coming webinar series. Thank you, Dr. Karen, for your nice presentation and your contribution of nursing component in global neurosurgery. We are really happy for that. Thank you so much for your time and welcome or goodbye.
Bye-bye.
Bye-bye.